Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today, the increased use of oral therapies means more freedom for patients with cancer, but it also means increased risks, making patient education especially important before they're sent home with these therapies. We're looking at education for patients with HR-positive, HER2-negative breast cancer. This is the second episode in our series about this topic. Our guests are Tammy Smith, a family nurse practitioner treating these patients at INOVA Fairfax in Fairfax, Virginia, and Dr. Pearman Parker, a registered nurse and assistant professor at the University of Arkansas for Medical Sciences. Thank you both for joining me today. Dr. Parker, let's start with you. What are some of the most important issues to educate patients and their families about regarding these oral therapies?
Thank you so much, Summer, for this question. So I will speak very broadly to this, as these are all very subject to the patients and also the medications that they're on. So we have our traditional, low white blood cells. Well, you cannot tell patients, oh, you're going to have a low white blood count. That doesn't, we must apply this information. So we have our nausea, our vomiting, our diarrhea going on. We sometimes have rashes going on, and these are manageable, and we need to really help our patients learn how to manage it, what they can do sort of up front. And all this sort of varies, and all these strategies vary that I have seen sort of more off-label uses to somehow treat some of these side effects, but also knowing what is a problem. So that is a little bit more of where the education really has the most potency. Say you're having some unexplained bruising, what's going on? Well, we need to go ahead and get in. We need to know this as clinicians to, reduce any side effects of thrombocytopenia or anything that may be going on with that. The best sort of advice that I've sort of seen working with, our clinicians, and then also with my own research, is knowing how to be uncomfortable in this space and asking these questions for your patients anyway. And then clinicians taking the leadership to connect with women, to ask women these questions that they may feel uncomfortable answering. But we've got to start somewhere, because it's not enough to say you're going to have menopausal symptoms on these drugs when not everyone would necessarily know what that means, especially younger women who haven't actually experienced this. Well, what are night sweats? How is that any different than, having a flu? So that is where I really just sort of encourage this conversation to happen. And it's interesting, Summer. So our materials do not really go into it that much depth anyway. Again, I think it's a reflection of our larger cultural sort of hesitancy to talk about this. But so that's sort of our hormonal aspect of this that's going on. And clinicians have to be very careful, because these may be reasons why women discontinue their medication early, is that they're not prepared to deal with the side effects and frankly don't find it of benefit. So that is our job as clinicians, to assess where a patient is continually. This doesn't stop. It's not a one and done. So ask them where they are, what they need. Do they know what this means in a very warm way? I don't have to tell our clinicians not to be condescending, but just in such a way to make this conversation that can be a little difficult open and help our women, manage this. So I think it's important to acknowledge it's all a little uncomfortable, but that's just part of it. So
Tammy, I'm going to ask you the same thing. What are you talking to your patients and their families about? What do they need to know about these oral therapies?
Right. So I always try to manage expectations up front, and so that the patients understand what they're looking at as far as side effects and what we can help them manage, as well as what they will have to do on their own in order to increase their quality of life throughout the process. And the key to that, of course, is education. Making sure that the patients are educated on possible side effects and the best ways to not only treat those side effects, but more importantly, how to prevent them.
Tammy, what are some of the side effects and potential consequences of oral therapies that you emphasize in patient education?
Yeah. Hematologic toxicities are really our number one focus initially, because This can lead to infections, anemia, which leads to fatigue. And so monitoring their blood levels, letting them know that initially they're going to have to come in for frequent blood work, just so we can monitor that. And then, once we see how their body's going to handle it, we can certainly lengthen that time in between blood draws. And so just educating them on what that process looks like, and that it doesn't always mean weekly visits, and that time can be expanded quite a bit. But that's probably our most serious side effects, because it can have the most daunting complications with infection. And then certainly it's the daily, day-to-day kind of nagging side effects that bother patients the most, like gastrointestinal upset, changes in their bowel function. So using antidiarrheals, educating patients that for them, they really have to focus on staying hydrated, exercising so that they don't become too fatigued and too debilitated. And then certainly skin issues of the hands and feet. They can get some swelling, pain of the hands and feet, itching, rashes. But I would say what patients complain about the most is likely the GI upset and the fatigue.
Dr. Parker, close us out. Talk to your colleagues. What do we need to keep in mind when it comes to educating and treating these patients on oral therapies?
Yes, specifically with our hormonal therapies, I think it will just be very good sort of in moving forward with our clinicians and our patients, just to be very empathetic to how challenging these side effects, specifically with hormonal therapies, can be, and how scary it can seem to have, all these side effects that you were not anticipating. And, like patients get very scared and then they don't necessarily know what to do, and that can erode the relationship a little bit. So I think the advice, and again, I've just been thinking a lot about this. One of the advice would be just for our clinicians to just really maintain this deep level of empathy for our patients beyond what sort of is normally there with hormonal medications, because it's very hard, it's very challenging, specifically with our premenopausal women. So that's my soapbox, and that's where my research is focused. So that is where I have spent a lot of time and energy. But I just really appreciated the opportunity to speak today. I've been very passionate about teaching, and then also about creating these bonds with our patients to help them have the best, experience, even though they're going through cancer. So, I know that's a bit odd to say, but why not? They're surviving, and we get to treat them. So we might as well get to treat them and then go through it and not suffer at the same time.
Thank you, Tammy, and thank you, Dr. Parker. This show is a resource of the Association of Community Cancer Centers, developed to bring oncology professionals the news and the latest trends in cancer care. If you're enjoying this content, please let us know by sharing it with your colleagues on Twitter or LinkedIn. This episode was made possible through funding and support provided by Lilly Oncology. Stay tuned right here for more in our 4-part series on patient education for breast cancer oral therapies. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.